Within gynecological cancer, you can think of all kinds of modalities to try and do the best for patients. I mean, a lot of effort is done on surgery, how to improve it, chemotherapy, targeted therapies. My ideas, based on the things I've done in the past, is that immunotherapy is the thing to go for. That's what it's all going to be about in the near future. It's not a fact that it is already an established tool which patients, with a lot of patients, are going to benefit from, but it's there and it's coming. One of the main simple things which you can tell at this moment is that we have for cervical cancer a prophylactic vaccine, something which 15 years ago people would have felt as being impossible, and it's there now. Millions and millions of young girls being vaccinated with a prophylactic vaccine, preventing the disease. So within 10-15 years, I have no doubt that we will have therapeutic vaccines as well, being an important part of treatment of patients with cancer. It's a prophylactic vaccine. Prophylaxis means you have to be there before you are confronted with what you need to get your prophylaxis for. And you're going to get confronted with this virus the moment you have sexual intercourse. So you have to do it before the age of 15, 16. So therefore the ideal age for the prophylactic vaccine is 10, 12 years of age. That's a prophylaxis. Looking at HPV, prophylactic vaccines are there, but therapeutic vaccines are in a clinic already at this moment. Not FDA or EMEA approved, but they are there and they are also clinical effective. Looking at other types of cancer, ovarian, endometrial, it's a question of time. And looking at all the drugs being available and have shown their great potential within diseases like melanoma and kidney carcinoma, known types of cancer where the immune system has an important role, it's a question of time that those modalities who are working there are going to be used within gynae cancers as well. Not as a modality treatment in itself, but to be combined with traditional treatment arms, being chemo, being radiotherapy. And it's important to know, which is not many physicians who are treating patients with gynae cancer are familiar with, is that the traditional things like radiotherapy and chemotherapy are not that effective if the immune system isn't doing what it is doing. That's only the basis for having other treatments to be combined with the traditional ones to get the immune system getting that job to be done better than it's already doing at this moment. The ones most easy to understand are those who are monoclonal antibodies. Monoclonal antibodies to specific parts within the immune system in which they or stimulate the immune system to do their job better, or preventing the immune system to step on the brake. In other words, to let the immune system go and go and go instead of what naturally is happening, that you put on the brake for the immune system, otherwise it will destroy you as a human being. And those drugs are available, quite easy to make, available already on the market, and that's the next step where we will be heading for. Next to other modalities which are harder to understand and harder to implement because they are more patient-tailored. It's harder to make, like within prostate cancer, which is now an FDA-approved drug, which is a dendritic cell-based vaccine made specially for every patient. It will be a question of time that will be happening in other types of cancer as well. For instance, in ovary. Get out your T cells from that patient, educate them where they have to go for, and then give it back to the patient. The future is ours. Oh, that's a very vital question to ask. And it tells you all about the fine-tuning of the immune system. I mean, the immune system, the T and the B cells, but look at the T cells, for instance. They are educated in life when you're very young, up to you're at the age of 1 or 2 years of age. The T cells are educated what's normal and not to touch that. That's what we call looking at what is self, what is not to be harmed. And everything which is not self, so non-self, is danger. If you get infected with an influenza virus, your immune system recognizes that as being non-self. There's a danger and it needs to cope with it. So the essential thing is, in the end, how does that immune system know that a cancer cell is different from a normal cell? Which flags are waving on that tumor cell telling, hey, I'm a tumor cell, kill me? Those are there, but it's a fine-tuned mechanism where we need to understand more about. But those flags are there on tumor cells. And in the end, with the immune system and fine-tuning in it, it's still more delicate, more easy to understand that is where we have to go for, compared with chemotherapy. Chemotherapeutics don't know what's a normal or a tumor cell. They just kill every dividing cell. Within the immune system, the fine-tuning, we need to work on it. But the flags are there on the tumor cell, and we will make use of it. The answer to the question is more or less simple in a way. The prophylactic vaccines are now on the market for the age of 12 to 15. So that means that all the girls and women being older are not getting that prophylactic vaccine. So for that age group and all those being older, we still need to develop new treatment approaches, being also therapeutic vaccines. Asking the same question in 50 years from now, then yes, the answer should be that there is not a real market anymore. Although, be aware that the prophylactic vaccine is against HPV 16 and 18. So there are still 8 other oncogenic HPV types which are not within the prophylactic vaccine and which we have to deal with.